Hello, everyone, and thank you for joining us today. My name is Margarita Dumboya, and I'm a specialized IVF coordinator here at Embryolab Fertility Clinic. Hope you're all doing well and remain healthy during these troubled times. Today, we're here to answer all your questions, and based on our experience as well, we will try to decode and clarify all the details of an IVF treatment for you. You see, here at Embryolab, we only offer individualized treatment plans based solely on your individual needs. It has been proven that this approach can maximize a lot your chances for successful outcome. So please send us your questions and we will try and answer each and every one. Let me introduce to you our panel, Dr. Michael Kyriakidis, fertility specialized gynecologist and medical head of Embryolab's International Department, and Dr. Achilles Papatheodorou, senior clinical embryologist and Embryolab's lab director. Michael and Achilles, thank you for joining us.
Hello, Margarita.
Hi, Margarita.
Hi.
I would like to welcome our viewers and our listeners as well. I hope we have a very interesting discussion for them, and I hope that we answer as many questions as we can today.
And I'm really happy to be with you and all the viewers in Facebook. And I just hope that we can be helpful for them after this discussion.
We will try, at least we will try, right? So starting with you, Dr. Kyriakidis, say a couple has just found out that the only route to create their family is through an IVF treatment. What is the very first thing they need to do?
So when a couple first understands that they have some sort of fertility problem or difficulties conceiving, usually it comes as a surprise. Okay. Usually we consider ourselves as, and we obviously are, the majority of us are healthy people, and we don't expect these types of difficulties. But as you understand, if a couple tries to conceive for several years and they do not succeed, then it means that there is probably something going wrong. In that case, I think the first step, the first move should be to visit a fertility specialist. I would avoid going into forums or asking other patients for their problems. I think a fertility specialist can really lead them and propose more specific tests where they can see what the problem is actually. So there is a series of screening tests that should be done, and they involve both parties, both parts of the couple, both male and female parts, and they include a thorough screening of the woman with tests done on the uterus, on the tubes, on the ovaries, and it involves also sperm-related tests to evaluate the consistency and the quality of the sperm.
So overall, how long does it take from start to finish for an IVF treatment?
Well, the first step, the screening tests, can take up to 1 month. Actually, there are some tests that need more than 2 or 3 weeks to have the results. These include the genetic tests that we sometimes propose. The basic test can be completed in only a week. So if we know and we have formed a plan for the couple, then the actual treatment from beginning to the end can last up to 20 days.
Okay, great. So here we have the first question. Jennifer is asking, do I need to take time off work once I start treatment?
No. I usually suggest that women and men continue with their everyday life. They continue with their routine. Women who go through the treatment will not experience any side effects, any severe side effects along the treatment. So they can go to work, they can continue with their hobbies, they can exercise mildly during the treatment. There is no restriction there. And usually they see no difference.
Okay, so we have a question coming in just now. I think Dr. Papatheodorou, this is for you. How much more successful is ICSI than just plain IVF?
More successful with it. Okay. Well, actually, when we do ICSI technique, what we are doing is that we put a single spermatozoon inside the oocyte. So we actually we are sure that we have put a sperm inside the oocyte, and so we are waiting. We have 85% percent chances of fertilizing this egg. So if we have an amount of oocytes, we are going to have a good number of fertilized oocytes, so a good number of embryos for development. When we are applying the conventional method, where we leave spermatozoa and oocytes during the night in an incubator, in both of them in the culture media to react, sometimes we might have failure of fertilization. So I would say that ICSI is a more, how say, you ensure at least a minimum, a good minimum number of fertilization rates. So it's I would say it's safer in terms of fertilization rates. Okay.
Excellent, excellent. So Sue 44 would like to know if the drugs used will affect her mentally and physically, Dr. Kyriakidis.
That's a very common question, and many women ask about the safety. Basically, it's the safety involved in this question. So far, we have been using these types of medication for several decades. Around 30 years have gone by since the beginning of these drugs. So far, we have no association between the use of these medication and any other for any problem, any disease, or any form of cancer. It is actually one would say that it's better that we use these medication. We get women pregnant, we get them to have babies, because this will offer them a protection against cancer. Women that do not deliver babies, do not have a baby, are at higher risk for breast cancer. So the actual process of getting a woman pregnant and helping her with her family protects her against future problems. Okay. So overall, these medications are safe. They do not cause any problems. They do not increase or any problems, or they do not augment any underlying problems.
Right. Another question we have coming in is how often can you do back-to-back cycles?
Back-to-back cycles are not very often, actually. A couple can do it. We can do back-to-back treatments. We can even do treatments in the same cycle. There is a specific protocol that we can use in emergency cases, let's say, where we do 2 stimulation rounds in one period, one cycle. Okay. Usually, however, the treatment is very demanding, meaning mentally demanding, because it can have emotional fluctuations. And usually women are very, very tired when they go out of the treatment because they're emotionally tired. So I would not propose to do back-to-back treatments. Although there is the option of doing them, I would leave at least 1 month of intermission between treatments.
Okay, so we turn it to you, Dr. Papatheodorou, because there's always the male parameter as well. So what tests are needed to assess the sperm quality before we start an IVF treatment?
So let me tell you, it's very important to understand that sperm qualities is very important for an IVF treatment. And, you know, after all, it's the one half of every IVF case. So when we know that when we take care of the male partner before every laboratory procedure, we can increase the chances of the couple to get pregnant. And well, we believe in Embryolab, and we put a lot of effort and we spend a lot of time in order to investigate for a possible male factor infertility. And during this investigation period, we ask men to do some diagnostic tests, as you said. And well, the basic one is the spermogram. You know, it's the test that we see some parameters of the sperm, and we focus in three of them, which is the concentration of the spermatozoa, the motility, and the morphology. And there are some standard criteria that have been set up by WHO, which actually determine which sperm is normal and which is abnormal. And beside the spermogram, where we have an idea of the fertility, let's say, of men, we ask for men to do a sperm culture in order to see if there is any microorganism or any bacteria or anything that is has infected the semen of the sperm. And probably we might, if we find something there, we might ask them to follow medication. And then there is some, well, men should test it by and do some genetic tests like the karyotype. We have to see if all of them, they have a normal karyotype in the right number of chromosomes, and they should be tested for cystic fibrosis, which is you know, a condition that could be involved in male factor infertility. And there are more specific tests like the DNA fragmentation test, where we test the status of the DNA of the spermatozoa.
Great. So Vicky from Southampton is asking, do you believe supplements help egg and sperm quality? And how long should my husband take them for? Any other suggestions, she says, are greatly welcomed.
Well, I will tell you about the sperm and if supplementation improves sperm, and I will leave Dr. Gynecologist to talk about the eggs. Okay. And well, regarding the sperm, yes, supplementation of vitamins and antioxidants could be helpful, has been proven to be helpful, and we can increase not only the concentration, but mainly what we see usually is that we increase the motility of the semen sample and the morphology. And we focus on the morphology, which is a very basic, is a very important parameter. And because sometimes when we have abnormal, high rate of abnormal spermatozoa, sometimes probably there is something underlying, there is a condition that is producing this kind of abnormality that probably is messing with the fertility of men. And so, yes, I would suggest to men to take supplements. And usually we ask them to take them for 3 months. And this is because a cycle of spermatogenesis is lasting 3 months. So if someone starts using vitamins and antioxidant treatment, in 3 months from now, his spermatozoa will be under this treatment, and usually we see an improvement in sperm parameters. Mihaly, you should talk about the eggs and how.
Ahile, you basically you covered everything about the male part of the treatment. What I wanted to add, though, is that we often doctors often forget about the male part. Okay, the male part is equally important in the success of IVF Okay, I know that the process is not as demanding as the woman's part for the men, but they're equally important. So the benefit from supplements is more apparent with men because the overall mechanism of spermatogenesis is an ever-going mechanism. It doesn't stop. It continues daily. The difference between men and women is that women have actually produced their eggs from their life in the uterus, okay, as they were growing as embryos. So women have actually the numbers that they have created in the first place, okay? No new eggs are created. So would the supplements work on women given that they do not produce new eggs? Well, the supplements will not improve the genetic quality, okay? They will not change the genetic material of women, but they can really improve the cytoplasmic mechanisms of the egg and thus the embryo that comes from that egg. So they can they can lower oxidative stress inside the cytoplasm, which means that it can help mitochondria work better, produce more energy. They can help other types of mechanisms that produce proteins inside the embryo work better. So the development of embryos, although it will not affect the genetic material and how improved the genetic material is, but it can work, it can improve the development of the embryos. So supplements are indeed recommended for women. Same amount of time is needed, around 2 to 3 months before you start the treatment, and they include several types of vitamins or other forms of enzymes or even minerals can help. But remember that it's not everything for everyone, okay? We need to see where this particular woman has a specific deficiency and work on based on that, okay?
Right, right.
Would like to add here and verify what Mihaly said about the cytoplasmic quality of the oocytes. You know, as an embryologist, usually I'm in the laboratory and I'm doing the fertilization, and there are cases where when we don't have good quality of oocytes, and we realize that when we do the ICSI technique, we know that we have lower chances of achieving a good embryo. And if supplementation can give us better quality of the cell, it's very helpful even for us that we are in the laboratory. Yes.
Okay, so we have another question coming in from Amelia, who writes that my husband has oligoasthenospermia. What it means, and can I stay pregnant naturally?
Okay. Oligoasthenospermia. So we have two words there, oligo and asthenospermia. This means that this sperm sample has a concentration which is it's, uh, it's not in the normal range, and the immotile spermatozoa are less than 50% of the population of the sperm. So we are lower from the limits that WHO has set up, and we consider this sperm that will bring a difficulty to the couple in order to stay naturally pregnant. So when we have a few sperm and immotile spermatozoa, our chances are lower. Michalis will explain as a guest that it's not zero, but it's depending where we are, because there is a range of oligospermia and a range of asthenospermia. So if we are close to normal, we might have difficulty to conceive, but we can actually get pregnant naturally. But if the spermatozoa are a few, when we are like lower than 1 million spermatozoa per male, then probably we are not going to get pregnant naturally, and we are going to need help from an IVF clinic. And so depending from where we are. So when you have a spermogram like that, you should go to your fertility specialist and discuss what your options are, how long you should wait, and when you are ready to go for an IVF treatment. Mihaly, you should help us with this.
I wanted to add something, Achillea, is I want to remind our viewers and our listeners that we should not get stuck on numbers, okay? The things that we're discussing, obviously, are decisions made by scientists, and they are choices made by scientists, okay? These are not natural laws. It doesn't mean that a person or a man that has a sperm analysis lower than the average, lower than the normal, cannot get pregnant naturally. Okay, this is a decision and a staging made by the World Health Organization based on data. Okay, so, and again, I want to remind our viewers that male problems, although sometimes they seem very hard to solve, believe me, the technology that we have to help these men, even with very, very low counts and very low motility, the latest techniques that our embryologists hold are let's say, it's very easy for them to help these couples, and we've seen very good, very, very high success rates, even with severe male problems. Okay.
Okay, so we have Grace from London who's asking how is the protocol designed at Embryolab Fertility Clinic? I have been told to start with priming. Will it help?
A very good question, Margarita. Protocol is, as I've told you, only a part of the treatment. Okay, the protocol involves basically the means that we have to recruit eggs and to collect eggs. Okay, obviously we need to find and adapt the protocols on the specific characteristics of every person, because there are different things that we need to consider. We need to consider a woman's ovarian reserve. We need to consider a woman's age. We need to consider the number of embryos or the eggs that we aim for. Obviously, some family planning is needed. And we need also to account for personal choices and personal beliefs, okay? The protocol is in our clinic, at least, is designed according to specific characteristics of every person. It has to do with the ovarian reserve. It has to do with the medication that we want to use, and it has to do with the goals that we have set. Priming is a form of pre-treatment, and it seems to work better in women that seem to have done IVF treatments. They have not responded very well to their initial treatment, and we need a change of plan to improve recruitment and sizes of follicles. It's easily done. It's actually very helpful for couples that travel also, because this way we can organize their trip. And I usually recommend this for women that have already done IVF, and we've seen a poor response or an unexpected response.
Okay. And we have another question coming in from Anlie Martins. What percentage of couples end up with embryos of enough quality for transfer after PGT? Are there any scenarios after PGT that there are gray areas for embryo transfers, and how are couples guided in their decision?
I think, first of all, Achilles will need to explain us what PGT is.
Yeah.
Okay. What are the benefits of pre-implantation testing?
Exactly.
And if there are any other forms of selection of embryos.
Let me tell you a little bit about the preimplantation genetic testing, which is a technique where during an IVF treatment, we can we can remove some cells from the developing embryos, and these cells, we send them to the genetics lab, and they apply a genetic technique like the NGS, like our friend Amelie asked. And we can see if the embryos that we are testing have aneuploidies, which means they have an abnormal or normal karyotype. And we can also use preimplantation genetic testing for monogenetic diseases. So we have two types of techniques and two types of cases actually. When we test embryos for aneuploidies, in order to avoid miscarriage, well, the number of the embryos that we are going to have for transfer is depending on many factors. Okay, it's depending on the origin of the problem that produces actually the aneuploidy. It's depending on woman's age. It's very important, and it's depending from the sperm quality. As a technique, I have to say that it is safe in experienced hands, in experienced personnel. You need, I mean, as I know as an embryologist, that is the most delicate technique that we have in our lab. So usually senior staff is doing, people that have a lot of experience, because you do well when you have experience and you know how to manipulate an embryo, you do not harm it. So and you can easily use it as it could be a very useful tool. Let's say that you have a good embryologist and you have a lot of embryos in your lab. The number of the embryos that it would be helpful you can use, it's depending on those three parameters that I told you. Well, in women that they are over 40, the number of the embryos with abnormalities in their chromosomes is increasing, and we might need a good number of embryos in order to have normal embryos to transfer. Well, in order, you will need, of course, the help of your physician, your fertility specialist, in order to take this decision, and he would advise you. And Michalis, what would you advise in Annelie's case?
Well, I wanted to add something first, because PGT is a very often discussion that we do lately, because it's widely available these days. Let me tell you that traditionally speaking, preimplantation testing started to help couples that they themselves had a genetic problem. Okay, couples that had, let's say, a gene problem that they didn't want to pass on to their children, or couples that have any karyotypic problems. Later on, as the technology evolved, we started using the test to distinguish between normal, numerical, chromosomally normal embryos from other abnormal embryos, such as embryos with Down syndrome. Basically, we are discussing the holy grail of embryologists, and the purpose and the aim of the embryologist is to find this embryo, this one embryo out of a big group that will give couples a healthy baby. Okay, so embryologists have formed several filters, and nature has formed several filters to exclude embryos that are abnormal from being transferred and implanted. Okay, PGT is one of the ways, one of the filters that we have to distinguish between normal and abnormal embryos. Another way is the blastocyst culture. So some couples have lots of embryos. So we then first allow nature to decide which ones can reach blastocyst, which means that these are the strongest. And then we allow the embryologist to perform the test, the pre-implantation genetic test, to see which one out of this small group is the genetically normal. So these are filters that we, nature and us scientists provide along the way. And at the end, we find ourselves with a limited number of embryos, but that's the way it's supposed to happen. Okay, that's how our species has evolved, and that's how we can keep your success rates very high. If we exclude embryos that are not normal. So the second thing that I wanted to say is that we know that fertility declines as we age. And this happens in women earlier than men. Men will see this decrease by the age of 55, 50 to 55. Men will experience this problem earlier, around the age of 35 to 40. So it's a different case when we discuss a couple aged 30 and a couple aged 40. Okay, when you have a couple where the woman is 40 and above, you need more embryos. When you have a couple where a woman is below 35, you need less embryos to have the same results.
Okay. Okay. So we have another one coming in, and it says, if the pre-treatment scan shows 4 eggs, is it worth stopping and wait another month? What is your view on this?
Well, it doesn't have to do with one specific scan, actually. Think about this. You may be treating a woman that has a very low ovarian reserve, and you see one scan, you expect 1 or 2 eggs, and you see one scan that you have 4 eggs. For this particular woman, this scan is a good scan. You not only continue with the treatment, but you complete it with the egg collection. On the other hand, you may be treating a woman that has a very high ovarian reserve, and you expect about 15 to 20 eggs from just one round. If in this case you see only 4 eggs, then no, you shouldn't continue, unless there are other circumstances that basically presses us into completing the treatment. Let's say a woman will undergo chemotherapy, and we need to freeze these eggs for the woman's safety and to protect her from protect her fertility. We will complete this cycle. It doesn't mean that we have fewer numbers, the eggs are not good enough. Okay. So every time you need to focus on the case and see specific characteristics before you make your decision.
Thank you. Thank you, Dr. Kyriakidis. Dr. Papatheodorou, my husband has globosospermia, which is 100% round head sperm. I can see that in our case, egg activation via calcium ionophore is our best bet. Any advice or any other treatments you can recommend?
Well, actually, the treatment, the way we treat these cases in globosospermia is with doing a process that is called oocyte activation, using a specific culture media that has calcium ionophore. Well, right after ICSI, we put the injected oocyte for around 30 minutes in this culture medium. And what we're trying to do is to, using this substance, is to imitate what's happening in natural conditions. And we try to trigger a reaction inside the oocyte in order to give a signal to the oocytes and tell the oocyte, now I'm fertilized, now I have a sperm inside me, in order the oocyte to understand in a cellular way to understand that is fertilized and can start developing. I would suggest this couple, this man, before doing an IVF treatment, to do several tests, several spermograms, to have a frequent testing in their sperm, because there are a lot of cases with globosospermia that we've seen at some point in some spermograms. We've seen among these globose spermatozoa, normal spermatozoa. We need to give some time to this case, to around 2-3 months with several testing. And when we see a good, I mean, when we see some normal spermatozoa, to freeze at that time this sample in order to be able to use it. So when we're dealing with globosospermia, let's say we have two plans in our minds. One, it's a pre-treatment where we try to find with several ejaculations and testing of sperm some normal spermatozoa and freeze it. If not, we will proceed with this sperm, but we're going to use the oocyte activation treatment. We're going to do it anyway in this case. And let me tell you that we have a good fertilization rate. We don't reach the standard fertilization rates like we have in all other cases, which is around 85%, but we have around 50% of eggs fertilized, which is, under these circumstances, it's a very good fertilization rate. So we are able to have good embryos and give good chances to this couple conceiving.
Excellent, excellent.
Let me add that remember that couples that deal with globosospermia have a natural conception rate of
Yes,
around 0.
yes, of course.
Okay, so 50% is a very big increase in fertility rates.
Yes.
Okay. And Christopher is also asking, when is it advised to freeze a sperm sample, Dr. Papatheodorou? Is there a huge difference between using a frozen sperm versus a fresh sperm sample?
Let me tell you first, there is no difference between using frozen and fresh sample. We know that there's long experience using frozen sperm, and so there's no difference. And actually, we use the freezing of the sperm as a tool in many cases. For example, we have a lot of people coming from abroad, which, well, in their first the first appointment, we freeze the sperm, we do all the testing, and then when it's time to do the treatment, actually the male partner could stay home and not come to Greece to do the treatment. And so there's no difference. So, well, actually, concerning the question when is best to freeze a sperm sample, well, it depending who is asking. If it's asking a man that is thinking about his infertility or a problem, a future infertility problem, so I would say the sooner the better. Actually, here we can say what we're saying to women when we tell them about preserving their fertility, that they should do it as young as possible. The same thing stands for men. Michalis said previously that we see declining of sperm parameters after 55, but there are some research, recent research that's saying that men over 40, they start having problems not in their sperm parameters, but they are causing problems in conceiving, and there are more, let's say, miscarriages in couples where male partners are over 40. We are realizing this now. We were always thinking that sperm doesn't have age. We can use it at any time. But we know now that over 40, there is some difficulties even in men. So I would say the sooner the better. The right timing to freeze a sperm is also when you have a good sperm. So when you are at the process that you want to freeze a sperm, do 2, 3, 4 spermograms, check which one is the best, and when the parameters are good, then freeze it. If you have a spermogram that doesn't have a good morphology, I would advise to give more samples in order to see if you have a different morphology and better morphology, and freeze and keep the one with the best morphology.
So Achilla, basically, we need to know our limits. We need to do 2 or 3 spermograms
Yes.
to know our limits. Okay.
Yes. It's not just one sperm, one freezing. Yes, you need to know. There are fluctuations in the sperm quality, in the sperm parameters. So we need to know the limits. Yes. And actually, I would advise all men to do annually or biannually sperm testing, a spermogram. And if they do it from a young age, and in order to know where they are and how their semen parameters are declining or changing, it's the correct approach in order to know where they stand in terms of fertility.
Great. First of all, I want to thank you everyone for sending your questions. We have many questions coming in. Thank you for joining us. For you that have just joined us, we're broadcasting from Embryolab Fertility Clinic in Greece. Please continue sending us your questions. We'll make sure we answer all of them. And to continue, we have a question here from Jessica, who's 29 and is thinking of cryopreserving her eggs. How safe is the process? How many eggs should I store to feel safe for the future? I think that goes to both of you, gentlemen.
Let me start by saying that you are making a very wise choice, Jessica. Women should consider preserving their fertility if they do not have a stable relationship or have not formed a specific family plan by the age of 32. Okay, so if a woman doesn't have a stable partner or is not interested in starting their families by the age of 32, they should seriously consider preserving their fertility. The best time basically is below the age of 35. We know that by the age of 35, the majority of the eggs produced by a woman will be healthy and normal. So the time is below 35. The procedure is actually very, very safe. Very safe. It does not involve the embryo transfer, obviously. The woman will go through the same type of medication that we use for IVF. The program lasts about 10 to 12 days. That's only the amount of days that you need to do the injections. At the end, we complete the treatment with the egg collection, where we collect the eggs, and then the laboratory will take over, and Achilles will explain how they do the freezing and what are the success rates and the survival rates. What I wanted to mention is the number. The number, actually, for women below 35, we gain even more success rates with each extra egg that we collect. This goes up to a certain point. The highest that we can achieve is with approximately 15 to 18 eggs. So there is no reason to collect more than 18 eggs. And up to 18 eggs, we gain extra success rates. I usually recommend that women aim for about 10 to 14 eggs, which is the appropriate number, in which case we balance numbers and egg quality. Eggs, as I told you, will then go on to the laboratory where they will be frozen. And as far as I understand, Achillea, it's another very safe procedure to freeze eggs.
Yes, yes, it's 100% safe. Well, it's a procedure where we take the oocyte that we have collected from the oocyte pickup, and around 2 hours after the oocyte pickup, we are denuding the eggs from the surrounding cells, and we check the maturity of the eggs. So all the mature oocytes, all the mature eggs will be frozen, and we follow a protocol where we put eggs in special culture media with that they are supplemented with cryoprotectants. That's how we call them. Actually, it's agents and chemical agents, but safe ones, that they protect the cell from the cryo damage. And after some incubation with this media, we place the oocytes in specific and well-designed carriers, and we put a small drop with 2 to 3 eggs in every carrier, and this carrier we plunge it in liquid nitrogen. And this is how we achieve the condition that is called vitrification. And that's the method that we use. Probably our viewers will know about, they read about vitrification. It's a technique where we transform this a small amount of liquid of culture media, a drop, we transform it to glass. And in this way, we avoid ice crystal formation, and we are achieving, we are actually storing the oocytes in minus 196 degrees Celsius, and we can store them there, I don't know, forever. I mean, it's a procedure that actually brought a revolution in IVF. And because it's 100% safe, and we have now protocols that can, after the warming of the oocytes, we bring the oocytes at their initial state, at their initial quality. And you know, oocytes were very difficult to freeze in the past. But when we changed our protocols, when we discovered that this technique, vitrification, can be so beneficial for the preservation of the eggs, we started applying it, and we saw really great results. Of course, the initial quality of the oocyte plays a great role in the survival of the cells. In our lab, we get 98% survival rate. I would like to say 100%, but I will not say 100%. I will say 98%. There are some oocytes that might not survive, but that's a deficiency of the oocyte. That oocyte, even as fresh, will have the possibility to give a good embryo. And let's say that this cryopreservation and warming method is bringing this problem earlier. Okay, so we have a very, very good technique. We have really excellent protocols, and the procedure is very safe. And what we see from my experience is that we see very good development from embryos coming from frozen oocytes. The embryos that you will have, you can freeze them as embryos, although they are coming from frozen oocytes. There's no difference in survival rates in these embryos. And let's say that the game has changed the last 5 years in this approach, in this technique. So we can advise women to preserve their fertility very easily. It's a safe method, it's a quick method. Age is very, very important. And as it concerns the number, I would like to share with you my experience. And I have to say, if you have 12 eggs, you will have, I don't know, around 90% chances of achieving a pregnancy when you are under 35. Okay, it's
Can
not
I ask
always easy to
something
get
also,
this.
Claire?
Yes.
Can I ask something also? Because some of our viewers will be wondering, how long can the eggs be frozen? Is
Well,
there a limit?
there is actually biologically there is no limit.
No limit. So time stops there.
Yes, you stop time, you stop the metabolism of the embryo, so the embryo doesn't do anything, stays there, and we are seeing every day women that they're coming and using their frozen eggs, because like 5 years ago they heard about all about the fertility preservation using their frozen and storing their eggs, and we see excellent results. Uh, yes, I have experience with eggs that have been frozen for 15 years, and they are like fresh. They are like fresh,
So,
and there is only if there is there is limit only if there is a legal limit, or there is a limit in the coming from well, there are countries that they have laws that they dictate that you should use your frozen biological material in up to 10 years or up to 15 years. So this is depending on every country what is what you can do with your frozen material. But in terms of biologically, there's no limit. You can use it like even after 50 years.
good.
Okay.
So let me draw a picture and then we'll proceed on to the next question. We have a student that has just graduated.
Yeah.
And she is considering her postgraduate degree, and this could take years. And she's also considering an academic career, which basically um, you need some time. This particular student, this woman, has to make a choice between having a family or focusing on her career. Wouldn't it be wiser to preserve your eggs, focus on your career then, and later on, when you find the need for a family, go back to your eggs when you were younger, so that you are able to have your children?
Yes.
Absolutely. Giving the right to preserve your fertility for later on is something that I believe that it's the right of every woman, right? And especially of the younger ones.
Exactly. Actually, well, yes, it's a very wise choice. Actually, this story that you are saying is no, it's a common story in our age, and let's say that is a gift that you can give to yourself, to your future self, uh, and it's a very wise choice, and I recommend it. Uh, Actually, I recommended it to my sister, and it was helpful. Okay.
So, gentlemen, we have another question coming in regards to hyperstimulation syndrome, Dr. Kyriakidis. So, there's a lady stating that she had hyperstimulation syndrome and ended up hospitalized with severe pain after implantation. How can we prevent this from happening again? And is the oocyte quality affected from the hyperstimulation syndrome, Dr. Papatheodorou?
Let me start by saying that the ovarian hyperstimulation syndrome can be a very serious complication of IVF, and it's related basically to the medication used along the way. It's related to the treatment plan, because there are ways to avoid it. And usually it's in a very mild form. We rarely see severe syndromes these days. Our clinic has been free of OHSS for several years because we keep safety of women above all. So we take all the necessary measures that we need to take during the treatments and after the treatments to avoid hyperstimulation. Usually, it does not really affect the quality of eggs. It can decrease success rates if a woman proceeds with transfer while being hospitalized or while having the syndrome. And this is another reason why we rarely recommend transferring where we see a person, a woman at risk for hyperstimulation. But these days, I think it's very rare that we see hyperstimulation, because the protocols that we use here in our clinic are, first of all, mild treatments, are mild stimulations, but also there are other ways to avoid the syndrome altogether. Achille, I don't know if you have any information on the quality of the eggs produced, and I don't know if it's about the hyperstimulation syndrome or the actual reserve of a woman. So we know that women that have very high ovarian reserves probably have polycystic ovaries. So is it the syndrome that causes the quality issues, or is it a polycystic problem?
Well, my opinion is that it's coming from the polycystic ovaries, and in these cases we have lower quality embryos, but the initial number of the oocytes that we get is higher. So we might have higher number of oocytes, high number of embryos, but the blastocyst or the developmental rate is lower. But at the end, you have enough good embryos to transfer. So there is a balance between the number and the quality. So in these cases, at the end, you still have good embryos to transfer. But yes, we do see lower developmental rate when we calculate it at the initial number of the oocytes that we have. But at the end, we always end up with embryos, good embryos to transfer. And sometimes also, let me connect this question with the previous question. In PCO patients, we might have more oocytes, but probably are more, let's say, sensitive to the process of the cryopreservation. Okay, we should have also this in our minds.
Okay, so we have a lot of questions coming in, and they're talking about the pandemic and about how the COVID situation is dealt at Embryolab Fertility Clinic. So we have Sue, who's asking that during the pandemic, she was infected with COVID-19, but she recovered without hospitalization. How long should she wait before she starts an IVF treatment for Dr. Kyriakidis? And will it affect the quality of her embryos, Dr. Papafilou?
Well, as you mentioned, Margarita, when we started our discussion, these are very troubled times that we are living in. Hopefully, things will improve as we start vaccinations. At the moment, we know that the virus does not really cause any fertility problems. Keep in mind, though, that it's a new virus. It's only about 1 year since we first encountered this virus, and all the data that we collect is from this 1 year. So we know that the virus doesn't cause any fertility problems. We know that the virus cannot be transmitted vertically from the mother to the baby. It's basically a respiratory virus. So any infections that we've seen to newborns were from caregivers in their environment. The logic, though, and the concept behind the measures that we take is to avoid transferring an embryo to a person that is infected, not because it will harm the embryo, but because this person may be dealing with complications because of the virus, because of the COVID virus, while being pregnant. Okay, so when the pandemic started initially, the European Society of Human Reproduction suggested that we electively freeze the embryos, wait for the pandemic to go away, and then start transferring. And that's what we did in Embryolab. At this point, we know that the pandemic is on the dropping rate because we will start the vaccinations. And if we know that if we keep our personal safety measures, we wear masks when we go outside or when we are discussing with other people in closed spaces, we know that we can be protected. The clinic here, in order to protect its patients, have formed a specific safety protocol. We regularly screen and monitor the patients. We try to avoid crowding the patients in our clinic. And that's why we have increased the duration of our appointments with the doctors and our midwives. At the moment, we feel very safe. We were the first unit in Greece that have received certification as a COVID shield. I would propose that you have at least 2 negative results, molecular results, PCR results, before proceeding, basically 1 week apart, these two, before proceeding to the beginning of your treatment.
Okay, can I, let me tell you that no, this COVID period, which is strange for everybody, we don't have so much data on IVF cases where women were positive in COVID, and they did they proceed in oocyte pickup and then embryo transfer. So there are not so many cases. All the cases that we know and they have been reported, we haven't seen any negative impact in the development of these embryos.
Great.
Okay? And we haven't seen any impact even when these embryos were frozen and they were transferred later when the lady was after was negative. So probably for what we know now, at this point, there's no negative impact in the development of the embryos.
Okay.
What we would consider is if a male is tested positive for COVID. There are some reports that are saying that probably his sperm for the following 2-3 months could have lower parameters, and he should monitor by doing spermograms. He should monitor his sperm parameters, and probably this couple might have to wait for 2-3 months until they start doing an IVF treatment. Okay, this is new data. I've read about it last week, and we should start thinking even about male partners. And if they are positive, we might have to wait a little bit and check the parameters before we start the IVF treatment.
Very interesting indeed. We have a very, very interesting question. It states, new vaccine has alert to not be used in case of pregnancy or planning pregnancy in the next 3 months. What do you think?
Well, basically, I think the statement is based on the fact that the trials done so far to these vaccines have not included pregnant women or women that got pregnant immediately after having the vaccination. Okay, the majority of volunteers that were included in these trials were men and women above the age of 50, which seems to be the serious cases of the COVID infection. So I think the knowledge that we have, the information are not conclusive at the moment, and that is why we cannot really recommend this vaccine to younger women.
Right.
It seems that the vaccine is safe for everybody. We don't really know because we have not screened yet. Okay, this probably will happen in the next few months.
Yeah, it's a logical thing to say. I mean, I don't know, Michal, is it correct? The pregnant women it's a different population from the general population, and since they're carrying a baby, we have to be very careful with what we are advising them. So it's safer to say not to do the vaccine and wait and see what will happen with all the general population, and then to start applying it to pregnant women. I guess that it's a logical thing. Yeah.
So thank you so very much. It was an excellent discussion. Very interesting questions indeed. Although we have tried to answer most of them, some still remain unanswered. However, we will make sure to answer them all. So please do feel free to send us your questions at info@embryolab.eu and our email address, and we will reply back to you as soon as possible. Alternatively, we will be happy to meet with you privately and free of charge on Embryolab's secure online platform and discuss in detail your individual case, even during Christmas holidays. The clinic remains always open and is ready to assist everyone to make their dream of starting a family come true. Dr. Kyriakidis?
Well, I wanted to thank everybody for listening to us. I hope that we had a very interesting discussion. I hope that we answered the questions as much as we can. And I wish them safety. Everybody of us needs to be careful these days. Let's keep healthy and aim for babies.
Dr. Papatheodorou?
It was really, really great pleasure interacting with all these people. And actually, I enjoyed it very much. I'm looking forward to do it again. Thank you, all of you, for all your questions. And of course, we will answer all of them. We see there are a lot of them. Well, I will stay safe, as we have said. Don't lose your hope. Come and do your plans as it concerns your fertility. Don't be afraid to visit us. We have a really safe environment, and well, happy holidays, and I wish you all the best.
Right, as Christmas and New Year is right around the corner, and don't we all need some good spirit our way? It is a good time to reflect and to take decisions and focus on new starts with positive thinking and determination that you will make this dream come true. We wish you all happy holidays and amazing new year. Have a great evening and stay well.